Let me introduce our presenter. So Dr. Yogman, you can see him on your screen, is a pediatrician. He has been in pediatric practice in Cambridge, Massachusetts for more than 30 years after several years working full-time at Boston Children's Hospital with Dr. T. Barry Brazelton. He is assistant clinical professor of pediatrics at Harvard Medical School, where he teaches and does research on the father-child relationship, which is what we're talking about today, developmental interventions, nutrition and behavior, power of play, buffering toxic stress, and much, much more, which might make its way into his presentation a little bit. So with that, Dr. Yogman, I'll turn it over to you. You have the power, and let us know if you need anything.
Well, thank you, everybody. I'm delighted to be with you. And I have a lot of slides, and if people want to need a copy at the end, that's fine. I can send them to Leslie, but I'll zip through and maybe skip over some material. But I have no disclosures, objectives. We're going to talk about the ability of fathers to successfully interact with babies right from birth. They've often been neglected and misunderstood. And I think part of the problem is their role is complementary to that of mothers, but unique and not redundant. And they excel in the kinds of play that develops executive function skills, exploration, and autonomy. We'll have a very broad definition of fathers. Let me hide this thumbnail. And we'll capture some of these issues, maybe not all of them, but certainly the fact that fathers have gotten much more involved since the 2008 recession and the impact on their employment, the pandemic where many fathers were stay at home, the diversity of fathers, the effects of their involvement on children, the emphasis on enhancing their involvement to support mothers, to support babies, and to support fathers' own involvement to mitigate their declining physical and mental health. We all know about the morbidity, increasing morbidity of men in middle age. Want to emphasize some new work on postpartum depression in fathers as well as mothers and the barriers to father involvement. The couple of interesting things. This is a New Yorker cartoon from way back, shows fathers' involvement at playgrounds. There was a hilarious skit on Saturday Night Live a few years ago that talked about a man's park where mothers were eager to get fathers out of the house. I knew things had changed when I saw some slides of a long-haul truck driver with a baby on his lap. Now, unfortunately, he wasn't wearing a seatbelt, but I knew things had changed. So we're talking about 74 million fathers in the United States, about 3/4 of them married, but lots of stay-at-home fathers, lots of single fathers. And a new area of research are 1 in 6 are non-residential fathers. We talked about diverse fathers of children with special healthcare needs, which I know is a subject dear to the hearts of many of our people in the audience. We talk about fathers that have children with multiple partners, are in the military, whose spouses are in the military, are incarcerated, are gay, bisexual, or transgender. So we're talking about a very diverse group of men, not just those that are married, single, or stay at home. Pediatricians, unfortunately, have not been, in spite of some of our writings, have not been terribly good at engaging fathers. Only 4% in a 2013 survey, only 4% asked fathers about parenting skills, provided resources, and certainly not many screened fathers for postpartum depression. After our original paper came out a number of years back from the Academy, and there were some interviews, one of the fathers wrote a letter that said he would come to the pediatric visit and was totally ignored. So I think it's important to direct some specific questions to fathers when they come to pediatric visits, so they feel very much engaged and involved. Now, one of the important points here is that work-family balance. So fathers very much feel that they are not spending as much time as they'd like with their children. 50% of dads really want more time with their children. So I want to talk about effects across the developmental spectrum. Uh, Prenatally, uh, important as much as possible to get fathers involved in prenatal visits with pediatricians and to coordinate with obstetrics. Um, there was an interesting study that fathers, believe it or not, in many cultures, there's something called the Kuvad syndrome where father actually takes to bed during pregnancy. But actually, it's interesting that fathers will see their internists with symptoms of abdominal pain, excess weight gain, insomnia, nausea, symptoms typically attributed to pregnant women. And in fact, after a lot of expensive imaging studies, the recommendation in the Annals of Internal Medicine was before you go through all that, ask the men if their wives are pregnant, because there is this well-known description of Kuvad. But father involvement during pregnancy has been associated in epidemiologic studies with a decrease in prematurity and infant mortality. And it's important to acknowledge that the majority of men are now present at birth in the delivery room. So when we look at postpartum, we can talk about the interactions between fathers and infants and fathers and toddlers. And this was our research that we did many, many years ago, which looked at the synchrony, comparative mothers and babies with verbal games back and forth, and fathers and babies, and showed that they can equally well match the interactions, the gaze response, the affect between fathers and babies and mothers and babies by 2 to 4 months of age. These competent servant return interactions that are often characterized as attunement. The one of the interesting points is that the interactions were, even though they were synchronous, and even we did some analysis of heart rate rhythms between mothers and babies and fathers and babies, and they were synchronized in contrast to those when a stranger entered the room and interacted with a baby. But the interactions of fathers were of a different quality than mother and infant interactions. They were more stimulated and arousing. So fathers would play more bicycling the legs game, tapping games, things that had the baby more sitting upright in the chair. This was in an infant seat, the father coming in and sitting in front of the baby. More typically, if they weren't constrained by this infant seat, fathers would be picking the babies up high in the air, and the babies would have chortling belly laughs, as opposed to the cooing back and forth interactions with mothers. So this difference in quality and interaction that I want to repeatedly come back to. In childhood, fathers were more likely to engage in rough and tumble play, whether they were the preferred play partner. Language was an important, interesting when we talk about the impact of father involvement. Fathers actually are less willing to interpolate baby's vocalizations. So they introduce more new words and they enhance the baby's articulation. So we actually get, with increased father involvement, improved language. They certainly encourage exploration and independence, improve social competence and academic readiness, increase pro-social behavior, and decreased behavior problems. In adolescence, father involvement is certainly related to decreased school absence, which is an increasing problem after COVID, improved cognitive development and academic success, increased independence and social responsiveness, improved gender role development, decreased depression and behavior problems, and decreased risk behaviors, really an important outcome of father involvement. So I want to delve more into the impact of father-infant play, which relates to this differing level of interaction that enhances arousal. So fathers are more likely to be the infant's play partner than mothers. Their play tends to be more stimulating, vigorous, and arousing for the infant. they're equally successful in matching emotions, but the quality of interactions of play is more more intense and more vigorous. Uh, and these high intensity interactions, fathers challenge children intellectually, while less intensive interactions with mothers provide safety and balance. 98% of fathers play with their infants several times a week, and their play, I think, is very interesting when we talk in detail about the value of play and playful learning. Is that uh, that kind of cooperation and cooperative interactions during play is a major impact on buffering stress and serves as an antidote, I think, to toxic stress. So to summarize the impact of father involvement across the board on both cognition, on social emotional skills, pro-social behaviors, secure attachment, and at-risk behaviors, lower rates of substance abuse, delinquency, and less truancy. So lots of benefits toward enhancing father involvement to the child. Obviously benefits to the mother to help with caregiving and decreasing maternal stress. We'll talk a bit about if mothers are depressed, fathers can provide a major benefit if they're not depressed at mitigating and supporting maternal mental health. But to the father's own physical health, there are benefits that fathers have improved nutrition, increased exercise, and decreased risk behaviors. So we talk about hormonal changes during fatherhood, and what we see is that the testosterone actually increases during conception and decreases during childbearing. Fathers actually, the interesting biological correlates, fathers actually differentiate their own 4-month-olds from others, as evidenced by correlations of salivary testosterone and functional MRI of prefrontal cortex activity. And paternal oxytocin levels are correlated with exploratory play, again back to play, particularly stimulating play, a different pattern than with mothers. So I want to focus in more detail on paternal mental health, particularly on perinatal postpartum depression, which has really not been recognized until recently, but it's certainly under-identified, not screened, and equally important, undertreated. Even when it's identified, referral resources act like they've never heard of this before, and they don't know what to do when they're receive a phone call asking for the services from a male. Data on paternal mental health, preconceptual, there's like a 4 to 5% baseline of depression. We don't have really good data on the prenatal period, but postpartum, the data varies all over the lot, roughly from about 10 to 25% postpartum. And it can occur a little later than maternal postpartum depression, which is typically 2 to 4 months. For men, it peaks at around 4 months, but increases out to age 1 and even beyond that to the first 5 years. Now, what's really interesting is the different symptoms of paternal postpartum depression. So men are less likely to display the typical symptoms of depression of sadness and vulnerability. They're much more likely to display irritability, anger, anxiety, fatigue, antisocial behavior. And so what we see is a lot of correlation with marital stress, with domestic violence, with separation that occurs postpartum, often related to paternal postpartum depression, substance abuse, and certainly men who are depressed can undergo nursing. Risk factors for paternal postpartum depression include obviously a history of prior depression, uh, non-resident fathers during the transition to fatherhood, in part because of the covariance of social determinants of health, race, racism, poverty, and unemployment. Uh, we talked about the fact that when mothers are depressed, almost 50% of fathers can also be depressed, but non-depressed fathers can really serve a major role in mitigating maternal postpartum depression. Clearly, a risk factor is the sleep deprivation that all parents undergo postpartum, pre-existing conflict in the co-parental relationship, poor physical health, having a sick child, especially prematurity, and the young age of fathers. So the impact on the child of a depressed father is quite important. There's less talking, playing, reading to the child, less time spent with the child, less physical contact, less school readiness, increase in conduct problems in preschool, in depression in adolescence, and a fourfold increase in spanking. So one of the recommendations that we're hoping will come out in a new policy statement is to recommend that people begin to screen fathers both prenatally and certainly, if not more often, at 4 months using the Edinburgh Postpartum Depression Scale. And we can talk more in questions about why we recommend the Edinburgh, which has actually been validated for fathers, even though it focuses on the more typical symptoms of depression. There is some work about other scales, such as something called the Gottman scale, that begins to look more at issues of irritability and anger. But for now, the most well-validated scale is still the Edinburgh. One of the things about enhancing father involvement is how minimal interventions can have long-lasting effects. So that bath demonstrations in hospitals show long-term impacts on fathers being comfortable handling newborns. Play prescriptions at well visits, play interventions at children's museums, but lots of other opportunities for encouraging fathers to attend pediatric office visits, to direct questions specifically at them so that they feel engaged and involved, and important to make them feel part of it. One of the issues that needs to get addressed across the board for parents are policies about leave. The U.S. Obviously is at the bottom of the barrel when it comes to paid leave related to national earnings, and you can see a graph of other countries in the world that have much more paid leave for fathers, and obviously this graph is well, it's a little better for mothers. It's still the U.S. is still at the bottom of the graph for most industrialized countries. So lots of work to do in terms of advocacy here. I want to address a little bit about fathers and special needs children. 20% of U.S. children are categorized as having a special need. Fathers particularly undergo some pretty unique and serious stress with a special needs child. There are additional financial pressures, pressures on work for them to be able to be helpful, to bringing children to extra medical appointments or psychology appointments, they feel very isolated and helpless. Fathers typically feel like they must play a very instrumental role in fixing things. And when special needs children have problems that are not easily fixed with an instrumental role of the father, they feel increasingly helpless. We have some data, though, that in a longitudinal study of premature infants that we did years ago, we looked at categorizing father involvement early on, and we found better cognitive outcomes at age 3, even after adjusting for maternal involvement. So I want to leave lots of time for questions, but I want to finish with a wonderful slide and a kind of a Mayan Indian quote. This is a Henry Moore sculpture in the Metropolitan Museum, and it shows illustrates this Mayan Indian quote. You can see that the mother on the right is holding the baby close to protect the baby from the world, as the Mayan Indian quote says. And the father is holding the baby outward facing the world, as the Mayan Indian quote says, taking the baby to the highest mountaintop to show them that the world is theirs. So again, it captures this complementary roles of mothers and fathers, and single parents obviously do both, but this balance of security, comfort, nurturance, the two kind of parallel themes of development toward the second theme of encouraging autonomy, independence, and exploration. And I think that children need both to grow up, and how families manage these two experiences is quite individual, and don't want to devolve to stereotypes. But I think it is interesting when one looks at the early interactions and play of mothers and fathers and babies as young as 2 to 3 months, that you can begin to see some differences in style and interaction that may predict later development. So why don't I pause there? I have a bunch of references, contact information, but I actually got through these slides a lot more quickly than I expected. But I'm happy to take questions, and we can go back to many of them if you like. So Leslie, I'm happy to field questions.
That's wonderful. So again, based on your comfort, if you want to put something in the chat, we can monitor that, or unmute and ask your question or share your thoughts. While people are thinking, I want to throw out a question in terms of one is kind of intervention speaking, and we might have several experts on here who could contribute to the conversation for sure. But in my mind, when you are for whatever the outcome or the focus of the intervention, therapy or otherwise, that you're looking at, would you, based on your work, Dr. Yogman, would you present things a little differently if both father, mother were involved? So I'm thinking PCIT, right? So that's looking at interactions. That's working with parents on how to facilitate their interactions in a certain way. Would your approach to fathers and mothers be different? What recommendations would you have for embracing that uniqueness that you described to us today?
Well, I think as you rightly point out, the parents' relationship with each other has a critical impact on the child. So number one, clarifying whether they are competing or conflicting, and wanting to point out that oftentimes a father is discouraged from, mothers can play a very important gatekeeping role. And for a variety of reasons, they can be quite critical of the father if he's not doing everything the same way the mother's doing. And so I think one of the things I'll try to clarify and give permission for is that, let the father have his own space. And as long as the baby is not cringing or complaining, it's often the case that in their interactions, they can be different and complementary, and without being judgmental, one can try to encourage the mother to allow that kind of a difference to occur and to encourage it.
Thank you. And then we have a chat. What do you think is the barrier to the U.S. giving mother, or is that, yes, U.S. giving mothers and fathers more maternity and paternity leave? Sorry, I messed that up, Mark.
Yeah, it's both a political question and a financial question. I mean, I think that some of the states have begun. I think Massachusetts has begun having a little deduction to create a fund for some paid parental leave. But I think for many states and the federal government has been reluctant to add any further benefits or costs to family budgets. And then there's the political issue of whether this country still has difficulties with encouraging mothers to go back to work with young children. And I think both of those have been impediments, but there are certainly there's been a lot of discussion in the current Congress about supporting parental leave, and it's the benefits are so enormous in terms of supporting children and families, and it's something we all need to lobby for and advocate for. And I think we have a number of policy statements coming out from the Academy of Pediatrics to advocate for this.
I'd be curious of the audience, not to put anyone on the spot, but for those who are providing services or training, do you see differences? And some might be similar to what Dr. Yogman described here, but do you see differences between fathers and mothers, or what are your thoughts on fathers and their representation in trainings, research? Just curious what
So
yeah, go ahead.
I'm off mute if you can hear me.
Yeah.
Hi. Yeah, and I'm Jeff. So I'm piloting a fatherhood program in Morgan County, and we're calling it Father Forge. But one thing I found interesting in this presentation, I just made a note of it, is the apparent tension between the word stereotype versus legitimate complementary roles. So I found this presentation refreshing, that certain things just need to be acknowledged, that is not based on opinions or trends, but the facts of what this illustration shows. So I just found that refreshing on that. So I appreciate the data.
Yeah, I think that's a really important point, and I think that one, as with many things, one wants to acknowledge that there's no one way that parents share responsibilities, share roles, and do things. And I think to some degree, the problem with our old stereotypes is it acted like there was only one way. Father was just going to be the breadwinner, not very involved with children, and that's no longer the case. And I think increasingly men have realized that they really missed out on something important to be much more engaged with their kids. And at the same time, people will often come back to me and say, well, what about single mothers? Well, I think single mothers, it's a stressful experience to raise a child on one's own, but single mothers manage it quite successfully, usually. And they manage to provide both of these complementary experiences. And it's an interesting process. So it doesn't mean that the children are completely. I think one has to look at strengths across the board with parents. And I think single mothers can have lots of strengths and can manage the play experiences and the encouragement of autonomy and exploration. But sometimes they need a little help to realize that both of those experiences are important for growing children.
And I appreciated your, just to add on that, the vision of the belly laugh, the dad holding the child up in the air, and
Yeah.
the belly laugh versus the cooing. It's just like, that's just awesome.
Right.
Technically speaking.
Come a long way. There's a wonderful program. I love hearing about the fatherhood group that you're doing. We have a wonderful program that I'm working with in Boston that takes formerly incarcerated fathers and would bring them to the Children's Museum with coaches to coach them on when they were released from jail on re-engaging with their children. And you could just see the joy in their eyes when they would bring their child to an exhibit making bubbles or whatever. It was really, and then the coaches would really work with them toward a whole new chapter of their lives. And working with their children was a much more hopeful and positive experience for them. And hopefully, with more and more data showing the decreased recidivism.
Real quick, let me go back up to the chat a little bit. Someone wanted to go back to your comment about the Edinburgh depression
Yes.
scale. The question is, do you have an idea of how many programs are using that as a screening for fathers?
I don't have any numbers. My guess is it's quite limited. Right now, even our advocacy, and we published a couple of papers a couple of years ago and got the Preventive Services Task Force, U.S. Preventive Services Task Force, and the Academy's Bright Futures to encourage all screening of mothers at 1, 2, 4, and 6 months by pediatricians, and got Medicaid to agree to pay for it and insurers to agree to pay for screening. And we still don't have an uptake of more than 50% among pediatricians with the best data that we've seen. So I think that screening of fathers is way behind. We're now writing a policy statement to encourage both the Academy and the Preventive Services Task Force to recommend it for fathers, but that'll probably take a few years to get published and probably longer than that to be implemented as policy. So what we can do is encourage it. But I think that it would be great to do it. We started doing it in our office, and I think we've tried to work with some of the child psychiatry access programs to develop resources so that if a father does screen positive, one can find a mental health professional who is knowledgeable enough to accept a referral for men. We had one man talk before our Massachusetts Postpartum Depression Commission, which is a gubernatorial commission, and said that when he called to seek help, he, the provider was incredulous that this phenomenon existed. So we have a long way to go.
Interesting. Austin, do you care to describe your program for one, and then you were wanting to compare experiences? Do you care to give us a little bit more about that?
Sure, yeah. So I do two programs through our FSC. One of them is the 24/7 Dad through the National Fatherhood Institute, and then the other is the Tuning into Teens, which is Australian-based. I think University of Melbourne, maybe, if I'm remembering correctly. But so one's the focuses on the father role, the other focuses on general parenting, both male and female. And I find it really interesting that the fatherhood group typically revolves a lot around the idea of breaking kind of these past cycles, if there are problematic cycles, with how the dads were parented, if there were issues, which oftentimes there's even if minor things that they want to change, but versus the general parenting group, even when there are dads present, it typically focuses on getting more into like the now, into what's influencing, what stressors and life situations are influencing our parenting now. And just was really curious if anybody had any feedback on that.
So I think you're raising a really important point, which is the father's relationship with his own father is often quite critical in either encouraging or discouraging how he's going to do things differently. And that's been a major focus of this Father Uplift program in Boston. And I'm glad to hear it's an important ingredient in your program as well.
I don't see him on here, but we have a colleague who provides mental health services who routinely describes the Appalachian. I heard Jeff talking about stereotypes and then this generational kind of laying it out of the stereotype, and the Appalachian piece, a strong man shouldn't do this. A dad in Appalachia should be like this. And so he notes, interestingly, that in his sessions that he has to take some time to detangle some of that. So it's interesting to hear you all talking about how you're approaching it and that needs to be addressed. It would be interesting to see how that in action,
Well, it speaks to this lots of work on the changes in the definition of masculinity, and whether it's all about being tough and being a financial provider and not allowing space for the social engagement with children and the ability to really be an active, involved parent. And I think that stereotype of masculinity is really changing. And most notably, I think the Surgeon General's statement about the impact of loneliness and isolation on the rate of middle-aged men's suicide and substance abuse really speaks to the level of distress and stress on men who are really how shall I put it, are limited by this stereotype, and they don't really increasingly men don't connect with other men. So I love the work that people are doing about having fathers groups so fathers can talk to other men about and whether it start on a basketball court or a whatever, but the barriers then start to break down and men start to talk about broader aspects of their lives, and I think that's a crucial intervention.
Thank you. Other questions, comments? Dr. Yogman, you had a slide on fathers and children with special healthcare needs. Could we talk about that a little bit
Sure.
in more detail? And so I guess just to start it off, this may not be a great question to dig more deeply into that, but how would you compare fathers' challenges, supports, resources between fathers of children with special health care needs and fathers of other children? Are they different? Are
Well,
they
I have
different?
one, yeah, one very poignant example. I gave grand rounds a few years ago at the Harvard Medical School to the psychiatrist. And after my talk, a psychiatrist came up to me and said, I never realized I had a premature infant who was in the NICU for months. And I got very depressed. And nobody paid any attention to me. And, partly it was that I felt so helpless. I couldn't do anything uh, to uh, and to help my child. Um, and so it speaks to, and I think we have some data recently. People were doing Edinburghs for several months uh, for fathers and mothers of premature infants, and the mothers actually recovered on the Edinburgh, their depression scores much more quickly than the fathers. So I think we don't do justice to the impact on fathers of having a special needs child, and its you know broader impact. So I think that's the main take-home message here.
Just kind of a raise of hands in individuals programming. How often do you involve the father? No judgment here. No judgment.
It's not an easy challenge because they don't voluntarily, necessarily participate. They're used to being ignored. And so you've got to make, there's all the general issues of scheduling, not during their work hours, whatever, but needing to make a special effort to encourage them to come. And then when they do come, to make sure they feel like it matters. Like, there are specific questions. I mean, I will often talk, particularly to fathers in a prenatal visit, where I encourage them to come about, how can they participate in feeding, in doing a night feed so their wives can get some sleep if they're, very sleep deprived and involved with nursing. If it's going to be a male child, does the father want the child to be circumcised or not? So you try to direct specific questions to the father so that he really knows his presence is important.
And you answered that my follow-up question was going to be of those that say that they're incorporating the father, obviously you're breaking that bubble. That's fantastic. So you spoke of strategies that they're obviously doing to get them involved, just to learn from others of how they're doing it is helpful.
Leslie, this is Corey Bean from the Boys and Girls Club. How y'all doing today?
Hey, Corey, just fine.
I know a lot of the success I've had anytime that we've involved fathers with absolutely anything we've done is that conversation, that acknowledgement that they exist, that they're part of the team and they're part of the program. And a lot of the times, like just having that simple conversation of like what they feel some of their struggles are and giving them an opportunity to talk to other people about that. Because I know myself and probably a lot of the people included in this very rarely, um, as a guy or as a parent, we're expected to know everything. You know what I mean? So like when we let down that armor that we are infallible and that we do bring emotions and complex things other than just anger to the table, um it's been really nice for them, and it's been a way that you connect and you start building that relationship from the go because you have those acknowledgments. And anytime that I've seen like the dads that are the quietest around everybody else, as soon as they like find their group, you know what I mean, and get in their groove, you're absolutely amazed at things that they'll share with you. But a lot of the times it's just that acknowledgement of, hey, you exist, and have you ever tried this, or what's hard, what's easy? Maybe you can teach. I've always used this, like, hey, come be part of the group. Maybe you can teach somebody something through the process, and then wink, wink, maybe you'll learn something too. But yeah, just asking them to be a part of the team is usually the most helpful thing I've ever experienced.
It goes a long way. That's helpful.
kudos to you, Corey. That's really fabulous. And I think it is breaking the barrier that men, it speaks to the concerns about the isolation that men have. They're not used to, talking to other guys about, feelings and about relationships. And anything we can do to break that barrier and break that ice is really, really helpful. And once things open up, it's a huge relief to everybody.
Okay, I'm going to flip the coin. So to develop programs, you start many times grassroots, and you guys are talking about your efforts in the communities and how you get them involved. Let's talk about research for a second. You put out a research recruitment flyer. Really doesn't have moms only, although I've seen a lot with just moms, for sure. But let's say you put out a research flyer that doesn't say moms, dad, everyone welcome. What additionally would you, what guidance would you give for someone on that end of the process to bring in more dads and to start getting their feedback and to build the programs with their feedback in the first place?
I think you have to specifically target fathers to get them, because the generic offer, it's really not gonna. Fathers are going to assume they're not really welcome, and so I think you need to go the extra mile to make it specific to them, so that they know they really are expected to participate. And I think that's why I think father groups are the best way to open this up and to do research right now. Most of the research, unfortunately, is on a very select subgroups of generally white upper middle class fathers. And I think a huge need for understanding. We didn't talk a lot today about non-residential fathers, but a really important group of men that often have two families, and yet they are often, particularly with some encouragement, involved with children in both families, with not a lot of support, so that I think the more we can do to engage them early on and to encourage their involvement is to everybody's benefit.
Wonderful. Any remaining thoughts or questions, or Dr. Yogman, any closing take-home points you want us to charge us with?
No, I mean, I think we've made progress over these years, but still a long way to go. But I think that I can't tell you the gratitude I've experienced in my practice and seeing families with fathers who really welcome their uniqueness being acknowledged and their participation with their children being acknowledged and supported. So I think hopefully everybody on this call can feel empowered and energized to keep up the good work.
Well, thank you so much. I appreciate everyone's time, Dr. Yogman. I appreciate your time and joining us. And what I did, just to close a few things, I did put in an evaluation. This information will be used to strengthen these opportunities so that we give everyone as much as we can in our discussions and topics. So please click that link. It's a quick link. If you do need a certificate of attendance, let me know, and I'll send that to you based on your email through registration. And with that, we'll close out. I appreciate it. Have a great afternoon, everyone.
Great. Thank you, Leslie, and thank you, everybody.
Thank you so much.